Welcome to Lesson 16, 2026 Psychiatry Coding from KS Medical Coding Academy. In this lesson, we'll learn the key concepts of psychiatric diagnostic evaluation, psychotherapy, crisis services, interactive complexity, and related E/M coding. We'll also review important CAPTAIN codes, Medicare considerations, common coding mistakes, and CPC style scenarios. Let's begin and build a strong foundation in 2026 psychiatry coding. Before we begin, let's review the objectives for Lesson 16, 2026 Psychiatry Coding. In this lesson, we will learn the basics of psychiatric diagnostic evaluation and psychotherapy coding. We'll understand the difference between 90,791 and 90,792, review interactive complexity, and learn the major individual psychotherapy codes. We'll also cover psychotherapy performed with E/M services, crisis psychotherapy, group and family psychotherapy, and other important psychiatry coding concepts. Finally, we'll review common coding mistakes in practice with CPC-style scenarios and questions. A quick disclaimer before we continue. This lesson is designed for educational and CPC exam preparation purposes only. Coding guidelines, CAPTAIN code descriptions, Medicare policies, and payer requirements can change. Therefore, always verify the current official CPT, CMS, and applicable payer guidance before applying coding rules to actual claims. This training is not intended to provide medical, legal, billing, or reimbursement advice. With that foundation in place, let's begin our 2026 psychiatry coding lesson. Now let's understand what psychiatry is. Psychiatry is a medical specialty focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. Psychiatric care can involve several important areas. First is assessment and diagnosis, which may include reviewing the patient's history, symptoms, mental status, and other relevant factors. Second is treatment. Depending on the patient and the service provided, treatment may include psychotherapy, medication management, or other appropriate interventions. Psychiatry also involves prevention and ongoing management of psychiatric conditions. From a medical coding perspective, the most important question is, what psychiatric service was actually performed and documented? The answer may lead us to psychiatric diagnostic evaluation, psychotherapy, crisis psychotherapy, interactive complexity, or psychotherapy performed with an E/M service. So, always focus on the actual service, documentation, and applicable coding guidelines rather than simply the patient's diagnosis. With that foundation, let's move on to the different types of psychiatric coding services. Now let's take a quick overview of the major psychiatry coding services we'll be studying in this lesson. First, we have psychiatric diagnostic evaluation. 90,791 is used for an evaluation without medical services, while 90,792 is used when medical services are included. Next is interactive complexity, reported with add-on code 90785 when the required communication factors complicate the psychiatric service. For individual psychotherapy, the primary codes are 90,832, 90,834, and 90,837, based on the applicable psychotherapy time. When psychotherapy is performed together with an appropriate E/M service, we use 90,833, 90,836, or 90,838, depending on the psychotherapy time. For psychotherapy for crisis, we have 90,839 for the initial service and 90,840 for additional time, when applicable. We'll also cover other important services, including psychoanalysis, family psychotherapy, and group psychotherapy. For every psychiatry coding question, use this basic CPC approach. Identify the service, determine the duration, check whether E/M is involved, review the documentation, apply the current CAPTAIN and payer rules, and then select the appropriate code. And remember, older training materials may contain outdated information. For 2026 coding, always verify the current CAPTAIN code set, CMS guidance, and applicable payer policies. With this overview complete, let's examine each psychiatry service in detail. Now let's look at two important psychiatric diagnostic evaluation codes, 90,791 and 90,792. 90,791 represents a psychiatric diagnostic evaluation without medical services. The evaluation may include reviewing the patient's psychiatric and psychosocial history, performing a mental status examination, making a diagnostic assessment, and developing a treatment plan. 90,792 represents a psychiatric diagnostic evaluation with medical services. In addition to the diagnostic evaluation, the documentation must support the medical service component. For CPC exam questions, remember this simple distinction: 90,791, without medical services. 90,792, with medical services. Do not choose 90,792 simply because the provider is a physician. The code selection should be based on the service actually performed and documented. Also remember that 90,785, the interactive complexity add-on code, may be reported with 90,791 or 90,792 when its specific requirements are met. For Medicare coding, there are also specific rules regarding same-day reporting and other services, so always verify the current Medicare guidance. The key takeaway is simple: identify the service, review the documentation, and then select 90,791 or 90,792 based on whether medical services were provided. Now let's move to interactive complexity and add-on code 90785. Now let's discuss interactive complexity, reported with add-on code plus 90785. Interactive complexity refers to specific communication factors that make the delivery of a psychiatric service more difficult. Examples may include significant communication problems, involvement of family members or other third parties, use of an interpreter, or behavioral and emotional factors that interfere with the psychiatric service. The important CPC point is that plus 90785 is an add-on code. It is not reported by itself. It must be reported with an appropriate primary psychiatric service when the required conditions are met. The documentation should clearly support the communication circumstances that created the interactive complexity. Here is an easy memory tip: 90,785 equals communication complexity. For the exam, remember the sequence: identify the psychiatric service, confirm interactive complexity, verify the documentation, and then add plus 90785 when appropriate. Always apply the current CPT, CMS, and payer-specific guidelines. Now, let's move on to individual psychotherapy codes. Now let's look at individual psychotherapy codes 90,832, 90,834, and 90,837. These codes are used for psychotherapy without a medical E.M. service. 90,832 represents approximately 30 minutes, 90,834 approximately 45 minutes, and 90,837 approximately 60 minutes. For Medicare, the code is selected based on the psychotherapy time actually provided: 16 to 37 minutes for 90,832, 38 to 52 minutes for 90,834, and 53 minutes or more for 90,837. Psychotherapy of less than 16 minutes should not be reported with these codes. For example, if the documented psychotherapy time is 28 minutes, 90,832 would be appropriate. If it is 42 minutes, 90,834 applies. And if it is 55 minutes, 90,837 applies. Remember that these are psychotherapy-only codes. When psychotherapy is performed with an appropriate E.M. service, we use the separate psychotherapy add-on codes 90,833, 90,836, or 90,838 instead. Another important point is documentation. For these time-based psychotherapy services, the medical record should support the actual psychotherapy time, service provided, and medical necessity. For your CPC exam, remember, 32 to 30 minutes, 34 to 45 minutes, 37 to 60 minutes. Always code from the documented service and time, and verify the current captain and payer requirements. Next, we'll look at psychotherapy performed with an E.M. service, 90,833, 90,836, and 90,838. Now let's discuss psychotherapy performed with an E.M. service. The codes 90,833, 90,836, and 90,838 are add-on psychotherapy codes. They are reported along with an appropriate E.M. service when the psychotherapy is separately identifiable and supported by documentation. The psychotherapy time ranges are 90,833, 16 to 37 minutes. 90,836, 38 to 52 minutes. 90,838 to 53 minutes or more. Here is an important CPC point. These psychotherapy codes cannot be reported by themselves. An appropriate E.M. service must also be supported. The E.M. service and psychotherapy should be documented separately, and the psychotherapy time should not be counted as E.M. time under the applicable Medicare methodology. For example, if the provider performs a medically necessary E.M. service and documents 42 minutes of separately identifiable psychotherapy, the psychotherapy portion corresponds to 90,836, along with the appropriate E.M. code. Remember the memory pattern: 33, about 30 minutes. 36, about 45 minutes. 38, about 60 minutes. Always review the documentation and apply the current CPT, CMS, and payer-specific guidelines. Next, we'll look at psychotherapy for crisis, 90,839 and 90,840. Now let's discuss psychotherapy for crisis and the codes 90,839, 90,840, G0017, and G0018. Psychotherapy for crisis is an urgent psychiatric service for patients experiencing high distress with complex or potentially life-threatening problems that require immediate attention. The service can include crisis assessment, a mental status examination, psychotherapy, resource mobilization, and interventions to restore safety. 90,839 represents psychotherapy for crisis for the first 60 minutes, while 90,840 represents each additional 30 minutes and is reported with 90,839. For Medicare, G0017 and G0018 are used for psychotherapy for crisis furnished at applicable non-facility sites other than the office. G0017 represents the first 60 minutes, and G0018 represents each additional 30 minutes. An important coding point is that these are time-based services. The total crisis psychotherapy time on the date of service is considered, even when the time is not continuous. The documentation must support the crisis condition, medical necessity, service provided, and time. Also remember that Medicare does not report crisis psychotherapy together with psychiatric diagnostic evaluation or the standard psychotherapy codes listed in the applicable guidance. For your CPC exam, remember, 90,839, first 60 minutes. 90,840, each additional 30 minutes. G0017, first 60 minutes at an applicable non-facility site other than the office. G0018, each additional 30 minutes at that applicable site. The key is to identify the crisis service, verify the site of service, determine the total time, and review the documentation. Always apply the current CPT, CMS, and payer-specific guidelines. Next, we'll move to psychoanalysis and other psychotherapy services. Now let's look at group and family psychotherapy, focusing on 90,853, 90,846, and 90,847. 90,853 is used for group psychotherapy, other than multiple family group psychotherapy. The service involves psychotherapy provided to multiple patients in a group setting. When the requirements are met, plus 90785 for interactive complexity may also be reported. Next, we have the two family psychotherapy codes. 90,846 is used when the patient is not present during the family psychotherapy session. 90,847 is used for family or conjoint psychotherapy when the patient is present. For the CPC exam, this distinction is very important. 90,853, group psychotherapy. 90,846, family psychotherapy, patient absent. 90,847, family psychotherapy, patient present. Another important point is that 90,846 and 90,847 are intended for treatment of the patient's mental disorder. They should not be used simply for taking a family history or providing general E.M. counseling. Under Medicare guidance, 90,846 and 90,847 should not be reported for services lasting less than 26 minutes. Here is an easy memory technique. 53 equals group, 46 equals family, patient absent. 47 equals family, patient present. So, when you see a CPC scenario, first ask, is this group psychotherapy or family psychotherapy? If it is family psychotherapy, the next question is the patient present? That will help you distinguish 90846 from 90,847. Always verify the current CPT, CMS, and payer-specific guidelines before applying these rules to an actual claim. Now let's discuss psychoanalysis and other psychiatric services. The key code for psychoanalysis is 90,845. Psychoanalysis is a specialized therapeutic approach that focuses on understanding unconscious motivations and conflicts. It is a different therapeutic modality from standard psychotherapy. An important CPC point is that 90,845 is not a time-defined code. Although a typical session is usually around 45 to 50 minutes, the code is reported once for each daily session, regardless of the actual time involved. The documentation should support the indication for psychoanalysis, the psychoanalytic techniques used, and the clinical rationale. Medicare guidance also indicates that the practitioner providing this specialized service should have appropriate psychoanalytic training. Other psychiatric services we should recognize include 90,880 for hypnotherapy, 90,853 for group psychotherapy, 90,846 and 90,847 for family psychotherapy, and plus 90785 for interactive complexity when the requirements are met. For the CPC exam, remember the important distinction: 90,845 equals psychoanalysis, not time-based. Do not confuse it with 90,832 through 90,838, where applicable psychotherapy services use specific time ranges. The coding approach is simple. Identify the psychiatric service, determine the modality, check whether the code is time-based, review the documentation, and apply the current captain and payer requirements. For 2026, CMS's current psychiatry billing guidance is effective from January 1, 2026, so always verify the current guidance before applying a coding rule to an actual claim. Now let's move on to psychiatry coding tips and common mistakes. Now let's understand an important distinction for CPC exam questions: CPT rules versus Medicare rules. Think of it this way: CPT tells us what the service is and how it is coded. Medicare adds rules about coverage, medical necessity, billing, payment, and where the service is furnished. For example, Captain identifies 90,791 and 90,792 for psychiatric diagnostic evaluation, and 90,832, 90,834, and 90,837 for psychotherapy without E.M. when psychotherapy is performed with an E.M. service, 90,833, 90,836, and 90,838 are add-on codes used with an appropriate E.M. service. Medicare requires the E.M. and psychotherapy services to be significant and separately identifiable, and the E.M. level is selected using medical decision-making. Crisis psychotherapy provides another important Medicare distinction. 90,839 is for the first 60 minutes and 90,840 for each additional 30 minutes. Medicare also uses G0017 and G0018 for applicable non-facility sites other than the office. Medicare can also place specific restrictions on reporting services together. For example, Medicare guidance says crisis psychotherapy codes should not be reported with psychiatric diagnostic evaluation or the standard psychotherapy codes listed in its guidance. So, for the CPC exam, remember this simple concept: CPT, what is the service? Medicare, can Medicare pay, and under what conditions? Your coding sequence should be: identify the captain service, right pointing arrow, check captain instructions, right pointing arrow, determine the payer, right pointing arrow, apply Medicare or CMS rules when applicable, right pointing arrow, verify documentation, right pointing arrow, report the supported code. And remember, Medicare guidance can change. CMS has published the 2026 annual CPT, HCPCS code list effective January 1, 2026, so always use the current year guidance when answering coding questions. The key takeaway is: do not stop at identifying the captain code. Always check the applicable payer rules before determining how the service should be reported. Now let's move on to common psychiatry coding mistakes and exam traps. Now let's review some common psychiatry coding traps that can appear in CPC exam questions. First, don't confuse 90,791 and 90,792. 90,791 is the psychiatric diagnostic evaluation without medical services, while 90,792 is the evaluation with medical services. The provider's credentials alone do not determine which code is correct. Second, always check the psychotherapy time. Codes 90,832, 90,834, and 90,837 are time-based. For Medicare, the applicable ranges are 16 to 37 minutes, 38 to 52 minutes, and 53 minutes or more. Third, remember that 90,833, 90,836, and 90,838 are add-on psychotherapy codes. They are reported with an appropriate E/M service when the two services are significant and separately identifiable. The psychotherapy time must be documented separately from E/M time. Fourth, don't automatically add plus 90785. Interactive complexity must be supported by the required communication circumstances and documentation. It is an add-on code and cannot be reported by itself. Fifth, be careful with family psychotherapy. 90,846 means family psychotherapy without the patient present, while 90,847 is family or conjoint psychotherapy with the patient present. These codes are for treatment of the patient's mental disorder, not simply taking a family history or providing general counseling. Sixth, don't confuse crisis psychotherapy with routine psychotherapy. 90,839 represents the first 60 minutes, and 90,840 represents each additional 30 minutes. Medicare also has specific rules involving G0017 and G0018 for applicable non-office non-facility settings. Finally, remember that 90,845 is psychoanalysis. Do not treat it like the time-based psychotherapy codes. For the CPC exam, use this sequence. Service right pointing arrow time right pointing arrow patient presence right pointing arrow E/M involvement right pointing arrow add-on code right pointing arrow documentation right pointing arrow payer rules. And here is the most important memory line: don't code by the diagnosis alone. Code the service actually performed and documented. Always verify the current CPT, CMS, and payer-specific requirements before applying a rule to an actual claim. That completes our review of the major psychiatry coding traps. Next, we'll apply these concepts to CPC-style scenarios in a knowledge check. Let's apply what we have learned to a CPC-style psychiatry scenario. An established patient presents with worsening anxiety and depression. During the encounter, the physician performs and documents a medically necessary E/M service and also provides 42 minutes of separately identifiable individual psychotherapy. The physician documents the psychotherapy time separately, and this is not a crisis service. Now, which coding combination is appropriate? The answer is the appropriate E/M code plus 90,836. Why? The psychotherapy time is 42 minutes. Under the applicable Medicare psychotherapy time ranges, 42 minutes falls within the 38 to 52 minute range, which corresponds to 90,836. Because 90,836 is an add-on psychotherapy code, it is reported with the appropriate E/M service when the requirements for both services are met. For Medicare, the E/M level is selected based on medical decision-making, and the psychotherapy time is not counted toward the E/M level. Now watch for the CPC trap. Do not automatically choose 90,792 simply because a psychiatric evaluation or assessment occurred. The documentation and applicable reporting rules determine the correct service. So our exam shortcut is E/M plus psychotherapy right pointing arrow determine psychotherapy time right pointing arrow 42 minutes means 90,836 right pointing arrow select the E/M level appropriately right pointing arrow verify separate documentation. The key lesson is code the services actually performed and documented, not simply the patient's diagnosis or the provider's specialty. Always verify the current CPT, CMS, and payer-specific rules before applying these concepts to an actual claim. Now it's time to test your understanding with a CPC psychiatry knowledge check. Question 1. A psychiatric diagnostic evaluation is performed without medical services. Which code is appropriate? The correct answer is 90,791. Remember, 90,791 is without medical services, while 90,792 is with medical services. Question 2. A patient receives 42 minutes of individual psychotherapy without an E/M service. Which code applies? The answer is 90,834, because 42 minutes falls within the 38 to 52 minute range. Question 3. A provider performs an appropriate E/M service along with 42 minutes of separately identifiable psychotherapy. Which psychotherapy add-on code applies? The answer is 90,836. Remember, 90,836 is reported with an appropriate E/M service when the requirements are met. Question 4. Family psychotherapy is performed without the patient present. The correct answer is 90,846. If the patient is present, remember 90,847. Question 5. Which code represents group psychotherapy? The answer is 90,853. And question 6. Which code represents psychotherapy for crisis for the first 60 minutes? The answer is 90,839. 90,840 is used for each additional 30 minutes when applicable. Now for the CPC challenge. A patient receives 55 minutes of individual psychotherapy without an EM service. Which code is appropriate? The answer is 90,837, because 55 minutes falls within the applicable 53 minutes or more range. Here is your psychiatry coding memory map. 90,791, diagnostic evaluation without medical services. 90,792, diagnostic evaluation with medical services. 90,834, individual psychotherapy, 38 to 52 minutes. 90,836, psychotherapy with EM, 38 to 52 minutes. 90,846, family psychotherapy, patient absent. 90,847, family psychotherapy, patient present. 90,853, group psychotherapy. 90,839, crisis psychotherapy, first 60 minutes. For your CPC exam, use this strategy. Identify the service, right pointing arrow, check the time, right pointing arrow, check patient presence, right pointing arrow, check EM involvement, right pointing arrow, check add-on codes, right pointing arrow, apply payer rules. The goal is not just to memorize codes. Understand why each code applies to the documented service. Always verify the current CPT 2026, CMS, and payer-specific guidelines before applying these rules to an actual claim. Let's wrap up Lesson 16, 2026 Psychiatry Coding with a final review of the key concepts. First, Psychiatric Diagnostic Evaluation. 90,791 is used without medical services, while 90,792 is used when medical services are included. For individual psychotherapy, remember, 90,832, 90,834, and 90,837 correspond to the applicable psychotherapy time ranges. When psychotherapy is performed with an appropriate EM service, remember the add-on codes, 90,833, 90,836, and 90,838. The psychotherapy component must be separately identifiable and properly documented. Next is interactive complexity, reported with plus 90785 when the specific requirements are met. Remember that this is an add-on code, not a standalone service. For crisis psychotherapy, 90,839 represents the first 60 minutes, and 90,840 represents each additional 30 minutes. Medicare also has specific rules involving G0017 and G0018 for applicable sites of service. For group and family psychotherapy, 90,853 is group psychotherapy. 90,846 is family psychotherapy when the patient is not present. 90,847 is family or conjoint psychotherapy when the patient is present. And remember 90,845 for psychoanalysis. It is not selected using the standard psychotherapy time ranges. Now let's review our CPC coding framework. Identify the service. Check the time. Check patient presence. Determine EM involvement. Check applicable add-on codes. Review the documentation. Then apply the appropriate payer rules. One of the most important lessons in psychiatry coding is that documentation drives code selection. Do not code based only on the diagnosis, the provider's specialty, or the type of visit. Focus on the service actually performed and documented. For 2026 coding, always verify the current captain code set, CMS guidance, and payer-specific requirements before applying a rule to an actual claim. And remember our final memory line: code the service actually performed and documented, not simply the diagnosis. That completes Lesson 16 to 2026 Psychiatry Coding. Great work! In the next lesson, we'll continue building your CPC knowledge with another important area of EM and medical coding concepts.